This conference will now be recorded.
Hi, everyone. Welcome, and thank you for coming today. My name is Allison Kogan. I am the chair of the ACRM Early Career Networking Group, and I am very pleased to introduce our speakers today for today's webinar, Drs. Heinemann, Dr. Leighton Chan, and Dr. Helen Hoenig, and they'll be presenting a webinar entitled Publishing and Peer Review Tips from the Editors of the Archives of Physical Medicine and Rehabilitation. Before we get started with the presentation, I do want to advise everyone that this meeting is being recorded. I'd like to ask all attendees to keep your phones or mics muted and keep your cameras turned off throughout the presentation. We do expect to have about 20 minutes at the end of the webinar for discussion. So if you have questions that come up during the webinar, please just place them in the chat box. Now I'd like to introduce our speakers. Dr. Alan Heinemann is a professor in the Department of Physical Medicine and Rehabilitation at Northwestern University's Feinberg School of Medicine and director of the Center for Rehabilitation Outcomes Research at the Shirley Ryan Ability Lab, formerly Rehab Institute of Chicago. He completed a doctoral degree in psychology at the University of Kansas, is a diplomat in rehabilitation psychology, and a fellow of the American Congress of Rehabilitation Medicine and the American Psychological Association. He is a past president and fellow of the American Congress of Physical Medicine and Rehabilitation and the Rehabilitation Psychology of the American Psychological Association. He serves as co-editor-in-chief of the Archives of Physical Medicine and Rehabilitation and is on the editorial boards of Rehabilitation Psychology and the Journal of Head Trauma Rehabilitation. Dr. Leighton Chan is a tenured scientist and chief rehabilitation medicine at the NIH Clinical Center, a 260-bed research hospital on the NIH campus. He received his BA from Dartmouth College and his MD from the UCLA School of Medicine. He received residency training in PM&R at the University of Washington. Subsequently, he completed a Robert Wood Johnson Clinical Scholar Fellowship, earned an MPH at the UW School of Public Health, and was a congressional fellow for the Honorable Jim McDermott from Washington. Dr. Chan has concentrated his research efforts on studying the healthcare and social services provided to individuals with disabilities. Over the course of his career, he has published landmark studies examining the impact of disability on healthcare. His research has resulted in more than 85 peer-reviewed articles, including 10 in JAMA, Lancet, and the New England Journal of Medicine. Dr. Chan's awards include the Young Academician Award from the Association of Academic Physiatrists, 2 Outstanding Teacher Awards from the University of Washington School of Medicine, and 4 NIH Directors Awards. He is the co-editor-in-chief of the Archives of PM&R. In 2007, he was one of the youngest individuals ever elected to the Institute of Medicine. Dr. Helen Hoenig is a professor of medicine at Duke University School of Medicine. Her research focuses on rehabilitation and more specifically on assistive technology and teletechnology. Her patient populations of interest include geriatric patients with diverse medical problems, including stroke, spinal, and musculoskeletal disorders. She uses randomized control trials and epidemiological studies, including large database analyses and survey research. She is nationally recognized for her expertise in rehabilitation health services research, geriatric rehabilitation, assistive technology outcomes, and telerehabilitation. So we are really thrilled to have these very prestigious speakers today for this webinar. And so without I will turn the presentation over to Dr. Heinemann.
Thank you, Allison. I'm delighted to have the opportunity to contribute to the early career webinar today, along with Drs. Chan and Hoenig. We are accessible after this presentation if folks have questions about this content that we share. Title of the presentation, Publishing and Peer Review Tips from Editors of the Archives of Physical Medicine and Rehabilitation. Next slide, please. So I'm sure folks are aware, the Archives is the official journal of the American Congress of Rehabilitation Medicine, along with our new daughter journal, ARRCT, which is led by Jeff Basford. We have 3 learning objectives today. I'll cover the first one, discuss manuscript preparation for peer review for archives of PM&R, including use of reporting guidelines. Second, how to serve as an effective peer reviewer for a scientific article. And third, how to respond effectively to a peer review request. Next slide, please. This slide, whoops, got ahead of myself here. Everyone who's participating, I think, today appreciates the critical importance of disseminating results of your research. It's not just enough to acquire funding, to publish a manuscript. We also need to find an audience. And that's where archives and other rehabilitation journals fit into that, addresses that need. We are primarily clinical rehabilitation readership. There are a number of clinical investigators who serve as authors and peer reviewers for manuscripts, but the clinical implications are what's primarily important. Finding the right journal is of paramount importance. Again, we are a clinical rehabilitation focused journal. More basic science articles would find a better home in journals that serve that audience. Some of the topics we'll present today will have a general focus, and some will focus more specifically on archives, specifically my section having to do with manuscript preparation. We look forward to a lively and interactive session, and we've allowed time at the end of the presentation to take your questions and engage in a discussion. All right, overview slide. I'm up first talking about issues in preparing a manuscript for peer review. Dr. Chan follows, describing reporting guidelines and how to assure effective integration in the preparation of a research project. Dr. Hoenig follows with peer review information, and then we'll have allowed time for discussion at the end. The next slide shows a screenshot of the archives homepage. We are celebrating 100 years of publishing. The name of the journal has changed a bit over the years, but we retain a focus on clinical aspects of rehabilitation relevant to a broad readership. Physicians, nursing, allied health, engineering, assistive technology, social scientists all find a publication home here. Our impact factor for the past year was 2.697. Actually, that was for published in 2019 for summarizing the prior 3 years. We expect that we will get the updated impact factor for the most recent year in the coming week or two. You can see here also a link to podcasts. We have a very distinguished and very effective interviewer, Ford Box at Shepherd Center, who also serves as a health reporter for CNN, who provides a podcast highlighting recent articles and issues in rehabilitation. You can see the most recent one appearing in June of this year focuses on an editorial by Helen Hoenig and Gerald Coe, focusing on the COVID-19 impact on rehabilitation medicine. Also an interview with Joe Giacino on the disorders of consciousness recommendations. You get a link here to the current issue. The content replicates what's in the print version. You can search for past issues and create an account and log in. ACRM members have an account courtesy of their membership. Next slide, please. So a bit of an overview on archives. We are on track to receive about 1,900 submissions for calendar year 2020. We can only publish 20 or so in any given month, so do the arithmetic. There's a lot of articles that we're not able to publish, and we end up recommending that authors pursue publication in another journal. So we are highly selective about the articles we choose, and try to emphasize those that can generalize broadly outside of a single facility and perhaps even relevant outside of a single nation. Authors can make extensive use of online supplements. We have a rather stringent word count of 3,000 words for original articles. We also have limit on the number of figures and tables. So sometimes the information that authors want to share isn't going to fit in print, but we do allow unlimited use of online supplemental material. Can be additional methodological details, can be additional tables and figures, or appendices of different sorts. We do monitor our impact factor. That reflects the number of citations articles received in the past 3 years relevant to the number of articles published. We've consistently ranked very high, and certainly want to deliver good value to authors and readers in terms of the content we deliver. A complementary way to judge the journal's impact is through Google Scholars metrics. They tend to be a little bit higher than the official impact factor, but another way to track the journal's utilization. Got another 3 screenshots coming up here showing on the next slide from Web of Science, updated last week, where funding comes to support the articles appearing in archives. U.S. Department of Health and Human Services is the largest chunk, including NIH on the bottom left with an additional 1,100. Add another 340 from the Kennedy Shriver NICHD Institute, and the National Institute on Aging, and the National Institute on Neurologic Disorders and Stroke, the National Cancer Center, and others. And you can see that federal funding from U.S. agencies is critically important in the authors' support for their research. Other international funders include the Canadian Institutes for Health Research and Australian agencies. This shows just the top few on this slide. The next slide illustrates where authors are from. Not surprisingly, it's English-speaking nations that form the largest bolus, though I think if you were to look at the publications per population, Australia and the Netherlands in particular are punching above their weight in terms of submitting a large number of high-quality articles. But you can see that authors come from around the world. Next slide illustrates affiliations of authors, just gives a sense of which universities and other sources are relatively large and relatively productive. The University of Washington, Northwestern University, my employer, the Rehabilitation Institute of Chicago, now the Shirley Ryan Ability Lab are on the left-hand side and account for the largest chunk, followed by Ohio State, University of Michigan, Baylor. So this would be a fairly familiar list of universities and hospitals with expertise in rehabilitation. The next slide shows the types of papers that we publish. Original articles are by far the largest set. As the title suggests, these articles report original research. It could be a randomized controlled trial, could be observational in nature, and certainly reflects the focus of most funded research projects. Brief reports up to 1,500 words is another category that we publish, so something can be said relatively briefly. We welcome submissions of this type. Systematic reviews with meta-analyses are an increasingly growing group of articles that synthesize information across published articles. We selectively publish some scoping reviews that have particular merit as well. Special communications are articles not reporting original research, but have summarized a topic of timely importance to the field of rehabilitation. Commentaries, as the name suggests, are comments on published articles, typically original articles. Editorials are written by editorial board members. One of the perks of their office is they are free to write on topics of concern to them. The information education pages are organized by ACRM's Communications Committee. They develop information intended for consumer or lay audience. We receive letters to the editor pretty routinely. Authors reacting to others, or readers reacting to authors' articles, sometimes requesting clarification or pointing out what they perceive to be an error or misstatement of sorts. And finally, measurement tools extracted from the Rehabilitation Measures database, a concise 2-page summary of measurement properties of instruments used widely in rehabilitation. Next slide shows the major components of manuscripts, focused here on what comprises an original research article. A title page includes not only the title and author affiliations, but we require disclosure of potential conflicts of interest and acknowledgements of key contributions from others. The manuscript file that authors upload includes an abstract. We have increased that recently to 300 words to allow fuller description of study findings, selection of keywords, mesh titles, abbreviations used in the article. The main text includes the introduction, methods, results, discussion with conclusions, followed by references and any figures and tables with separate legends. As I mentioned earlier, authors are free to upload additional supplementary files, appendices, additional tables and figures, and we require disclosure of funding sources and potential conflicts of interest. We use the International Council of Medical Journal Editors to help achieve that. Next slide shows that we require structured abstracts for our article. Again, this is 300 words that have the major headings listed here: the objective, design, setting, participants, interventions, main outcome measures, results, and conclusions. It's often helpful to have co-authors or an independent reviewer read this in advance of the submission to make sure it's complete. And as Dr. Chan will describe, reporting guidelines help remind authors of what key information we're looking for in an abstract. Next and final slide of my presentation just reminds you what the main sections of the manuscript are. I've already mentioned these, but let me just highlight that important component are the study limitations. We expect authors to discuss the extent to which findings will generalize or may be problematic in generalizing, any glitches in the design or execution of the study that would help readers judge the relative strength of the article. Well, with that, I'll turn the microphone over to Dr. Chen, and we'll talk about reporting guidelines and trial registration.
Thank you, guys. Can you hear me?
Yes.
Great. Thank you so much, Alan. Thanks for that great introduction. And I'm going to talk a little bit about two very important things that you need to consider right at the start of your research project. So, although we're talking about it in the context of submitting papers, frankly, when it comes to considering reporting guidelines and trial registration, these are things that you need to focus on right at the very beginning of any particular research project. So, next slide. So why reporting guidelines? So, as Helen will mention in her part of the presentation, this is just increasing scrutiny of the validity, reproducibility, accuracy of healthcare publications. And I think the need for that has been completely highlighted in the current COVID crisis, when we are desperate for information that we can rely on to make clinical and frankly family decisions to keep us safe. And what's become clear over decades is that there have been serious shortcomings of research. Probably the most common stuff is sort of outright fraud, but that's a rare event. And more concerning is sort of the systematic shortcomings that come with inaccurate reporting, selected reporting of outcome measures that can all color the way in which we view a research project is appreciated. Those research projects then can work their way into systematic reviews, which can then work their way into clinical guidelines. So it's critical that we really focus on the quality of the reporting for research. So next slide is why reporting guidelines. So reporting guidelines really essentially identify and force the author to report all the aspects of a research study. And so for those of you who are junior and now just getting started, don't think about reporting guidelines actually when it comes time to writing up the paper. Think about looking for reporting guidelines when you start your project, right at the very beginning. And so where would you go for these reporting guidelines to outline what it is you need to document around how you did your research? Well, probably the best place for this is the Equator Network. This is the Enhancing the Quality and Transparency of Healthcare Research. It was launched in 2008, and it supports the implementation of reporting guidelines really to increase the usability and value of health research. Next slide, please. This is one of the, I think, one of the most successful multidisciplinary initiatives to advance the quality of reporting in healthcare research. And so all of you who are getting into academics should get to know this network and their websites. They have tools that are available to all of us to improve our research. And it's really been done over the past 15 years, and it's taken on really an international flavor. So the Equator Network was originated both here, but also in England, I think with a biostatistician named Altman. Next slide. So what is a reporting guideline? What are the key reporting guidelines? Well, reporting guidelines are separated out based on the type of research you're doing. So if you are doing a randomized trial, then you need to report different aspects of your study. You would use something called the consort reporting guideline, and it has in it all of the key aspects that you need to think about, including your flow charts, your inclusion criteria, exclusion criteria, so on and so forth. If you're doing an observational study, it's not randomized, you would use something called STROBE. And if you're using a systematic review, you would probably document using a PRISMA guideline, tests of diagnostic accuracy, STARD, and case reports CARE. So each one of these study designs has a different type of reporting guideline, and you can access it using the web links in this presentation. Next slide. This is a screenshot of the Equator Network website. Again, it's very international in nature, and you will find that that there may be more than one reporting guideline for a particular type of study design. So if you're reporting a study protocol, maybe the fourth one down here, there's the SPIRIT guideline, there's the PRISMA guideline. For randomized trials, there's the consult guideline we already mentioned, but there are extensions to that. So if you have certain types of randomized trials, there are other pieces to this that may be applicable to you that you need to work through. So get familiar with this website, utilize it, and again, think about reporting guidelines and trial registration, as I'll mention in a minute, at the very beginning of your project, not just when you are writing it up. Next slide, please. So how are reporting guidelines integrated into the review process? Well, about, I don't know, probably 5 or 6 years ago, the archives led a movement amongst literally all rehab journals. I think we had 30 partners at the time to require guideline documentation for every single original article, research article that was submitted. And that was the first time really that any field had ever come together where all the major journals had decided to make a change together, literally to improve the quality of research of an entire field. And that has gone over, I think, very, very well. Most journals now are utilizing it, requiring it. How they actually implement integrate the utilization of reporting guidelines may have a slightly different spin. So for us in the archives, we require the guidelines to be presented at the time of initial submission. There are other journals in rehab that may do an initial screening, and then if it looks like you're going to get accepted, then they'll require it. So you need to consult the individual journal that you're submitting to find out when the reporting guidelines are due. But essentially, by the time you get to acceptance, if you get to acceptance, you will need to have provided the reporting guidelines at some point. So next slide. All right, switching now to the next topic of trial registration. Well, what is a clinical trial? And I don't have a definition here, but frankly, what I'm going to do here is I'm going to take the NIH definition, which we should have put in the slides. I'm going to copy it. I'm going to put it into the chat box to everybody here. And send it. So for those of you who are okay, there are a bunch of hyperlinks in here, but I'll read it to you. So what's a clinical trial? NIH has a very broad definition of a clinical trial. It's a research study in which one or more human subjects are prospectively assigned to one or more interventions, which may include a placebo or a control, to evaluate the effects of those interventions on health-related biomedical or behavioral outcomes. You'll note that in this definition, there's no mention of the word randomized. So a clinical trial can occur without having a randomized trial. We kind of link those two together often, but in fact, a clinical trial doesn't have to be randomized. And the reason we register clinical trials is so that authors don't have necessarily the option of cherry picking their results, right? So clinical trial registration requires that you say, all right, this is the question that I am going to ask. You put that down. These are my methods. These are my primary outcome measures. And you document that and you put that online at clinicaltrials.gov or some other trial registration website. And that remains there forever and for all time. This is what I was going to do in my research study. And then any reviewer can go back and say, all right, well, this is what you said you were going to do. This is what you said you did. And how do those two things match up? If all of a sudden an individual said they were going to report, say, 6-minute walk as their primary outcome measure, but in fact, when the paper came to you, they were looking at some other measure of quality of life as their primary outcome measure, you know that they may have shifted their primary outcome measure, and you have to ask why. Are they doing that because they're cherry picking their results, or they're doing that for a reasonable reason? So those are that's what clinical trial registration is. That's why you register. When do you register? For us, we need people to register before you start seeing patients, before you've enrolled in a particular, you had any patients enrolled in your study. We do that because we want to do it at the very beginning of the trial rather than halfway through when individuals may have already made some different decisions and may have tried to sort of take advantage of certain things. So that's our rule. Some other journals may have other rules, but we require clinical trial registration before your first patient is enrolled. Where to register? Well, the most common is clinicaltrials.gov. That's a US program supported by the NIH, but there are other clinical trial registration locations throughout the world. Almost every country usually has one. So next slide. Excuse me. All right, so that's my presentation, and I think I'm going to turn it over to Helen, who I believe is on the call now.
I am, and thank you very much. I will try and move through these slides relatively quickly so that to make sure and allow a bit of time for questions at the end. So peer review. When you submit a manuscript, it goes through a process. That process often includes peer review, and then ultimately you may get to respond to the peer review. So I'm going to take you through our process step by step. Next slide. Peer review, and this is a bit of history. I like history. Peer review is actually a relatively recent phenomena. The earliest example of peer review was the philosophical transactions with the Royal Society of London in 1965. And then another similar kind of thing in 1731 in Scotland. But it didn't become common until the mid-20th century. Grant-related peer review didn't start until the 1930s through the National Cancer Institute, but it's quite widespread now. Next slide. So this is the basic peer review process. You, the scientist, study something. You write your results. You submit it to the journal, hopefully our journal. The journal editor, that would be myself, Dr. Chan, or Dr. Heinemann, takes a look at the article. We will do what we call triage. There's some articles that just clearly aren't right for our journal. Maybe they're right for a geriatrics journal or a, exercise metabolism journal, whatever it might be. We do this triage, and for a goodly portion of what's submitted to us, we will turn it right around and say, thank you very much. We don't think we can publish this. It might be a better fit for here, or maybe our online journal, our open access journal. We try and get those back, get some level of response within a week if we don't think that it's going to be a fit for us. If we think it might be a fit, the next step is to assign it to one of our expert section editors. And I think we've got 40 different section editors with expertise in differing areas, speech therapy, physical therapy, occupational therapy, etc. The section editor will review it. They may again say, I just really don't think this is a fit, and let you know right away. Not a fit for our journal, maybe send it to our open access, or maybe be a better fit for a different type of journal, or they may send it out to peer review. If it's sent out for peer review, the peer reviewers will read the article and provide feedback to the editor. The editor then passes that back to the author, and it can be passed back as, based on peer review, we really don't think we can publish this in our journal. Or it may be as what we call a revise and resubmit, where you get a chance to respond to the peer review comments. It sometimes will be a revise with minor revisions. I can't remember the last time I know of something that was just straight accept. That's the overview, 20,000 foot of the process. Next slide. So going over what I just said, manuscripts are screened by us to initially by the editorial office to ensure all the key sections are present, that you meet our word count. We've got a software that looks for plagiarism. Then it goes to myself or the co-editors in chief. We also, again, take a look for formatting, review the software report on plagiarism. Sometimes on some methods, there's only but so many ways you can say randomized clinical trial. So there is a certain judgment call we'll look at to make it sure it's scientifically sound and that it's relevant to the journal. Next slide. And as mentioned, we may do a do not pass go. It could be that we'll reject it with an option to resubmit. This would be, for example, if it fails our plagiarism screen, but we think in ways that are editable. So it might be that you've published previously on the subject and you just copied your methods word for word. Well, you may need to rehash it. Or it might be you didn't realize you can't just copy from someone else's paper and reference it. You can't. You need to put it into quotes if you're going to do that. It might be it fails our word count screen and we think there's, real merit to this, but you got to get it down less than 8,000 words. Or there may be fixable English language problems. It could be that there's a rejection with no option to resubmit to us. It might be the science just isn't good enough. It might be not sufficiently innovative, or maybe it's not relevant to our journal. Things that we really don't take in archives include animal studies. If it's not got a rehabilitation application, we take very few studies with, I apologize for the typo, healthy subjects or case reports. Next slide. If it goes out to peer review, I want to spend some time now talking about that. There's pros and cons to peer review. We're going to talk about the cons first. What are the downsides? For your perspective as the author, you may feel that the reviewer was biased in some way or uninformed. Going through peer review does delay publication. For the reviewer, the downside is it's time consuming and it's unpaid. As the editor, the downside is finding reviewers. Sometimes not all reviewers think alike. You can get one that says, I think this is great, and another that says, boy, I have a lot of problems with this article. Sometimes the peer reviewer misses problems. From the journal perspective, authors can scam the peer review system, and we have a couple of examples coming up. There's also a lot of non-peer review open access competition out there now, where it's kind of a pay to publish and rapidly publish system, but without that peer review. So why do we do it? Next slide. Well, not yet the next slide. Here's some of the scandals. These are a couple of examples. There was a sting that was actually done by a very eminent journal, Science, and they found that there were false scientific papers published by 120 journals. They actually set up a false paper, submitted it to umpteen journals, and unfortunately it got through. It was much more common that this false paper got through with a non-peer reviewed journal, but there were a couple peer reviewed journals where it got through as well. And in fact, Sage, another well-known journal, had to retract 60 manuscripts. In this case, the author acted as their own peer reviewer. They put in a fake email for someone with a fake title and then served as their own reviewer. One result of that is we don't usually have authors recommend their own reviewers, and when they do, we'll certainly take a look at it, but we will always find some of our own peer reviewers to avoid this kind of a scam sort of situation. Next slide. So why do we do it? What's the upside? For you as the author, a peer-reviewed publication gets more respect. Most CVs you separately list peer-reviewed publications versus everything else. And if you're ever going to go for tenure, the peer-reviewed counts for more. Peer review improves the quality, both of the writing and of the science. I've been doing this for a long time, and I am very grateful to peer reviewers for helping to improve my personal product. It also enables you to fix problems before the public would see them, and then, God forbid, you have to do an errata. For the reviewer, the upside is you're contributing to the general good of our profession. I also find as a reviewer, it helps me to keep up to date with the latest developments. From an editor's perspective, it improves the quality of the product of our journal. It helps to ensure publications are novel and some substantive. It reduces, but does not eliminate, the risk of fraud. It also increases readership and impact. The net result is we are a peer-reviewed journal and we believe in peer review. Next slide. So overall, which is it, boon or bane? Peer review does have limitations. It's slow, it's conservative, it can be a bit unreliable, and biases are real. You know, we all get stuck on our preferred ideas. There are biases. As an editor, we keep a close eye on those peer reviews to try and identify anything that might be an institutional or other kinds of biases you don't want. I won't seek a peer reviewer from the same institution as the author, for example. But peer review engenders trust and respect among lay public and academicians. It improves clarity and accuracy. And while there's been a few studies that have had some concerns, overall the net impression is that peer review is positive. Interestingly, there have actually been some studies of do peer reviewers prefer anonymity, what's the pros and cons. We have what's called a double-blinded peer review. The peer reviewer doesn't know who wrote it, and you, the author, don't know who the peer reviewers were. The data shows that anonymity doesn't per se improve the reviews, but people are more comfortable with it. And just off the screen are some links to where the evidence is on that, should you be, at least it's off my screen, but probably not the recording, should you be interested in learning more. So overall, boon rather than bane. Next slide. What can you expect from peer review? What's realistic expectations for you, the author? You can expect to have informed, unbiased reviews. You can expect that it will improve the clarity of your manuscript. You can expect that it will help to ensure that the publication is targeted to the right audience. It will detect inappropriate copying and poor science, and it helps to ensure research will meet basic ethical standards. Including verification of ethics, IRB approval, and the clinical trial registration. Next slide. But it's not a panacea. We can't wholly detect falsification of data or other malfeasance. There's a certain amount of trust that the author accurately and correctly presents what they've done. And it can't ensure that science is not fraudulent. Again, we assume honest preparation and presentation. Next slide. And this is an example. There were 2 big COVID studies that recently had to be retracted because the data set ended up they couldn't verify the data set. We hope that our peer review process will prevent this kind of thing from happening, but it still can. Next slide. We do have challenges in finding peer reviewers. Like I said, you can make suggestions. We will always supplement it with peer reviewers that we find from our own network of colleagues, from people who've reviewed from us before, and the Elsevier system will use keywords to match with other people who've published on the topic, and we will use all of those to find good peer reviewers. Next slide. Now, it's important if you're going to be a peer reviewer, and I hope all of you will, if you want good peer reviews, you need to be willing to do peer reviews as well. So this is how to be a constructive peer reviewer, because we don't want it to be this kind of process. Next slide. It's important to be courteous and constructive. The author, yourself, spent a lot of time and effort on submitting it. You need to provide systematic comments on the various manuscripts sections, wending your way from abstract through introduction, each section of the methods, etc., the tables and the figures. You want to minimize spending time on copy editing, every last comma and period. We have copy editors. And it's important that you, the peer reviewer, know your role. You, the peer reviewer, will advise the editor. The editor makes the decision and takes into consideration all of the reviews, then their own impression and the journal needs. And sometimes we make decisions that are different than what the peer reviewer might have thought. Next slide. Now, what if you get your peer review? You have to respond to it. First and foremost, read the letter and all of the comments start to finish. Have a friend or a mentor read it. It's often not as bad as you think, and most concerns are answerable. So don't stop at the, we aren't able to publish your article. Keep reading to read, we think it needs revisions, or we think it would be a better fit for a different journal. Or now we are, I think, on target to have 1,900 submissions this year. We can't publish but a small portion of those. So we established an open access journal where we are recommending people consider publishing in our open access journal, where we think it has merits, but it's just really not quite up to archives. If you get a revise and resubmit, then you need to provide a point-by-point response to all the concerns, including the editors, whatever they may say, and the reviewers. Next slide. Response doesn't mean you have to agree. It might be that a reviewer wants you to do something that, you know, just really you are focused on this in your study, and the reviewer is excited and suggests that. It might be that your data set won't really allow you to do the analysis the reviewer suggested. So you don't have to agree, but you do need to be courteous and constructive in your response. The reviewers devoted unpaid time and effort on it, and they, you know, have, you know, generally speaking, are somewhat attached to their comments. Next slide. The bottom line is the golden rule. So you do unto others as you would have them do unto you. If you want good peer reviews, you need to be willing to provide them for others. And you need to respond to the peer reviewer in the same way you might wish, were you a peer reviewer, the response that you'd want from the author. And I think this might be my last slide. Let's see. Next slide. Oh, for more training, there's a couple of really good sites on training about peer review. The British Medical Journal just has an outstanding site that actually goes through some of the history that I put out there was from this. It's very, very good. And they have an article that you get to follow for the peer review that actually, as I recall, was an article submitted to British Medical Journal way back when of a randomized trial of copper bracelets. So it's actually an example that's apropos to rehab. It's very good. Annals of Internal Medicine, I also like their site. They've got a very a video that's useful and entertaining. So those of you who want to learn more, I'd recommend either of those sites. Next slide. Which leaves us time for questions. I actually left 9 minutes.
Bravo, Helen. Thank you for covering a lot of valuable content in a brief period of time. So folks who have questions, could, Allison, correct me if I'm wrong, unmute themselves and ask the question, or use the chat box feature to ask your question.
Yes, that's correct. And I do want to thank all of our 3 speakers for that excellent presentation, and thank you for sharing your expertise. So if you do have questions for the speakers, you can enter them in the chat box, or I think we have a good enough size group that we could, you can unmute yourself and ask your question.
While we're waiting for the first question, let me note that the URL that Leighton mentioned is in the chat box for folks who want to follow that.
Well, while we wait for, do we have a question from the audience?
Hi, this is Amy Harold. I just have a small question on the special publications and archives Can you give a couple examples about what type of articles or topics fit within that category?
Well, we certainly should be able to do that. I think if you click on our website, archives-pmr.org, and look at the current issue link for July of this year, you can see the full table of contents. We feature several articles, and then under, well, this month we did not have any special communications.
This is examples that I'm aware of because I was involved in them. We did one a couple months ago, myself and another one of the section editors, on COVID and rehab. A couple of years ago, a different one that I was involved in was on global health and rehab. It's a bit of a broad catch-all for articles that really aren't amenable to systematic review, but are topics that are timely and important to the field. And we've deliberately left it, I'd say, fairly open and don't constrain that, as we want it to be there for cutting edge things that don't otherwise fit neatly into a current box.
From April of this year, Dr. Chan published a scoping review on rehabilitation scoping reviews. I'm sorry, that was, the title just slipped here as I was searching. Let me just amplify what Helen said. There are a number of special emphasis issues that we'll publish on a specific topic. One that I led focused on measurement of environmental factors that may influence rehabilitation outcomes. We had several papers reporting original research, but the overall conceptual framework that we developed didn't have original research to report. So we summarized the issues and tried to advance theory a bit in that introductory article.
Now, even though we're mentioning special communications that we've been involved in, this is not by any means limited to having one of the editors being involved. They're just ones that come to mind.
Was there a particular study that you were interested in knowing whether it would fit into the special communication category?
Perhaps. I'm working with some folks on a theoretical framework for developing intervention for a clinical trial. And I know that may be tough to fit in some different, journal categories.
So one comment is you can always email the editors-in-chief and ask, is this topic a potential fit for archives? So that's and either Alan or Leighton will get back to you.
Great, thank you.
We would need, rather than just a title, we need a bit of meat on the description so we can give you an informed decision.
Sure, like an abstract, would that be?
Yeah, an abstract, and sometimes even more than that if you're there. It doesn't have to be a full paper, but the more you give us, the better educated decision we can help you with.
A way of example, I received a query today about a prospective cohort study looking at telemedicine for COVID-19 specific population. The author included the abstract, which is really helpful in assessing relevance to the journal. So I encourage people to do that.
Now we have a couple questions in the chat box. One of them is a question, if when an article is transferred to the open access journal, is the review transferred as well, the peer review that may have occurred?
The answer to that is yes. That's one of the advantages of accepting a direct transfer. If we can't publish your paper in archives, and we suggest that you consider transferring it to our sister journal, then all those reviews and your uploaded files go directly to the new journal. So it's a very sort of seamless process.
Next question is, how can an early career researcher become a reviewer? Self-nomination. Let us know that you're interested. There's a mechanism to register folks in our database. If you contact us, particularly Glenn Collins, our general manager, we're happy to guide you on that process. This also gives an opportunity to acknowledge the hard work and great quality that many reviewers provide annually. We recognize folks who do a specific number of reviews and get graded well by the editors. We recognize them as elite reviewers annually, and several reviewers have received that distinction several years in a row. We are indebted to reviewers to the quality of the journal.
I think we're actually ending with, if we're ending 1 minute early, if there's no more questions.
I think so, yes. I think we are ending right on time. It is the top of the hour, so I do want to thank our presenters once again for sharing their expertise with us, and thank all of you for joining us and listening in. Please do share this with your colleagues and let them know about our webinar series. This recording will be posted online within 24 to 48 hours, so please do look for that. And this concludes our webinar for today. Please be safe and healthy, and we hope to see you at the next time as well. Thank you.